Okay, so these are the procedures to take a standard skin fold test. You want to make sure that the participant is wearing clothes that allow easy access to all skin fold sites. You're going to start out by pinching the appropriate skin fold using the thumb and index finger 1 centimeter proximal from where the jaws of the calipers will be placed. Start wide and bring your fingers together to create a fold. Place the jaws of the calipers half the distance between the base of the skin fold that is not held with the fingers and the crest of the fold. The calipers should be perpendicular to the fold. Do not twist the calipers so they are easier to read. After you have measured all the sites, the measurements can be placed in multiple equations to calculate the percent body fat.
So right now we're going to be doing a chest skin fold test. What she's going to do is she's going to grab a skin fold diagonally between the nipple and the crease between the arm and the body. And she's going to take a measurement about 1 centimeter down from her fingers and about half a centimeter from the body.
Next is the mid-axillary. You're going to take a vertical fold along the mid-axillary line at the level of the xiphoid process of the sternum. The subject's arm should be placed on the tester's shoulder or just held up to best gain the access to the mid-axillary line. Place the jaws of the calipers 1 centimeter below and perpendicular to the vertical fold.
So now we have the subscapular skin fold test. What you're going to do is you're going to find the inferior border of the scapula. If you have trouble finding that, you can have the subject put their arm behind their back and flex. You can see that the scapula sticks out right there, and it's really easy to find the inferior border. Once you do that, you're going to have them stop flexing and put their arm by their side, and then you're going to take a diagonal skin fold at the inferior border of the scapula and put the calipers on 1 centimeter below the fingers and about half a centimeter above the skin.
Okay, so next is the triceps. You're going to have the subject stand facing away from you with the right arm hanging straight down. Standing behind the subject, pinch a site 1 centimeter above the midpoint between the shoulder and the tip of the elbow on the posterior aspect of the tricep.
So now we're going to move on to the abdomen skin fold. How you do this is you take a skin fold about 2 centimeters to the left of the belly button or the umbilicus, and you're going to pinch a vertical fold and take a measurement below.
Next is the suprailium. Grasp the skin fold just above the iliac crest at the level of the anterior axillary line along the natural cleavage of the skin fold, running diagonally down the crest toward the umbilicus.
So now we're going to move on to the thigh. So what you want to make sure with the thigh is you want to have your subject stand with all of their weight on their left foot and a slight bend in the right knee. And then you want to make sure that their shorts are moved up just a little bit so you have access to about halfway between the inguinal crease and the patella. And once you do that, you're going to take a vertical fold. And with this vertical fold, you have to make sure that you get in there because there's not a ton of fat on the thigh. And then once you do that, you just take a skin fold test. So when doing circumference measurements, it's important to note that you should always be using a spring-loaded tape measure. This allows for reproducible tension so that if there are different people taking measurements at different times, they can all have the same amount of tension. When you're doing this, you're measuring both separately, so you'll measure the waist and the hips at 2 separate times, which will be explained in the videos after this. And it's also important to note that this is just a ratio, so the calculation is just waist over hip.
So next we are going to do the waist circumference measurement. To measure the circumference of the waist, wrap the tape measure around the subject from the anterior side. Place the tape at the narrowest circumference between the umbilicus and the lowest rib. Resolve any twist in the tape, cross the tape, and switch hands to avoid having your arms cross each other. Confirm that the tape is parallel to the ground all the way around the subject. Have the subject relax the abdominal muscles. If you have a spring-loaded tape, Pull the tape to the calibrated tension. Record the measurement in centimeters to the nearest millimeter at the end of the normal expiration.
So now we're going to move on to the hip portion of the waist hip measurements. To take a hip measurement, what you're going to do is you're going to come in on the lateral side and you're going to place the tape at the largest circumference of the gluteus. Make sure that when you're doing this, you wrap it around parallel to the ground and make sure that there are no twists or anything in the measurement tape. Once you do that, pull it tight so that the tension is doing its job and measure the circumference to the nearest millimeter.